Hi, next we will discuss regarding newborn care. What is this newborn care? Newborn care is nothing but the care providing to the neonates or newly born babies immediately after birth or later. That one we will call newborn care. Newborn care is nothing but the care provided to the neonates or newly born babies immediately after death and later. That one we will call newborn care. So newborn care is classified immediate care of newborn, later care of newborn. What is this immediate care of newborn? Immediate care of newborn is nothing but care of the baby that needs to be given at the birth. Care of the baby that needs to be given at the birth in the labor room. That is immediate care of newborn. Later care of newborn, care of the baby that needs to be given in the postnatal ward or after discharge at the home. That we will call later care of newborn. Next, elements of newborn care. What are the elements? Elements of newborn care is nothing but basic preventive care including clean delivery practices and exclusive breastfeeding. What are the elements of newborn care means? First element is basic preventive care. Basic preventive care including clean delivery practices and exclusive breastfeeding. And second element is early detection of danger signs. Third element, treatment of problems such as sepsis and birth asphyxia. These are the main elements of newborn care. What are the elements of newborn care? First element is basic preventive care including clean delivery practices and exclusive breastfeeding. Next, second element is early detection of danger signs means we are any danger signs are there in the newborns, early we can detect while giving care. Third one, treatment of problems such as sepsis and birth asphyxia. If we are identify any problems, we can provide treatment like any sepsis, like infection or birth asphyxia, that and all. If we are identify, we can provide the treatment. These are the elements of newborn care. Next, immediate care of newborn. Immediate care of newborn. What are the main objectives? Objectives of immediate care of newborns: to establish and maintain respiration. Means in the newborns, we are establishing and maintaining the respiration. And second one, to ensure warmth. Because there may be temperature changes will happen when baby was in the mother womb and when it is coming out of the mother womb, there may be difficulty to baby face difficulty to adjust that internal environment to external environment. So immediate care what we are giving that to ensure the warmth of the newborn and to prevent infection and also to provide care to the high. While delivery, the baby faces fast from the reproductive tract, so that time there may be some infection, maybe any bacteria or anything can be sitting on the baby's eyes, so it may cause any infection. So to provide care of the eyes and to provide care of the umbilical cord and to provide care of the newborn skin and also to make observation and documentation and also make identification and transfer. These are the objectives of immediate care of newborn. Next, what is this care at birth? I told immediate care of newborn is nothing but care at birth. What are that care you are providing at birth? First one, wipe mouth and nose for any secretion after delivery of the head. You have to wipe the mouth and nose of the baby for removing any secretion after delivery of the head. And next, second one is positioning. Trendelenburg, head lower than the body. side lying position. You have to provide side lying position to permit drainage of mucus from the mouth. How to provide this side lying position? You have to place small pillow or roll towel on the back of the baby to prevent rolling back in supine position. And next you have to suction the baby mouth with the bulb syringe or using short catheter from the nose to prevent any aspiration. Immediately afterward, you have to do suctioning using a bulb syringe or any short catheter, from mouth, then from the nose to prevent aspiration of fluid into the lungs. And next, immediately after baby coming out from the mother womb, you have to keep the baby on a warm and clean dry towel to provide warmness and comfortable environmental temperature. And then you have to wipe the both eyes separately with sterile swabs. Next, clamp and cut the umbilical cord. After 1 minute of the birth. Next, using piece of towel, you have to dry the baby body. And then you have to assess baby's breathing. While drying, while cleaning baby, you have to assess the baby breathing. And next you have to keep the baby between mother breast to start skin to skin care. Next you have to cover the baby head with cap and cover the mother and baby with warm cloth. And you have to place an identical label or band on the baby hand. And then you have to encourage the mother to initiate breastfeeding within half an hour of the normal delivery and after 2 hours of the LSCS. These are immediate care of the newborn. Next, later care of the newborn. What is this later care? Already I told this care we are providing in postnatal ward or in the house. So what are the objectives? Objectives of later care: to receive the baby in the postnatal ward, to initiate feeding, to prevent infection, to maintain personal hygiene, and observe early signs of disease or congenital anomalies, and to provide parental teaching. First objective is to receive the baby in the postnatal ward. The baby delivered in the labor ward, then from labor ward to postnatal ward for receiving the baby, you have to make every arrangement. Next, to initiate feeding, you have to teach the mother, if mother is give birth to first baby, you have to teach regarding breastfeeding. And to prevent infection, unnecessary touching of baby and touching some other things, and for example touching some dirty things and again touching back to the child, this is not good. It will cause transfer infection. So before touching baby, you should have to wash your hands and you have to keep maintain your personal hygiene and even baby's personal hygiene. And during that later care, you have to observe for any early signs of disease or congenital anomaly. If the baby have cleft palate, the baby will not feed properly, and baby have any abnormalities in the brain, it will start to cry in high pitch cry. And also you have to provide parental teaching regarding how to take care of baby in the home. Next, vitamin K injection. Vitamin K injection helps to blood clot to prevent serious bleeding. if any vitamin K deficiency will cause hemorrhagic disease of the newborn. So you have to give vitamin K injection. This is regarding newborn care.